We are the Kenyan Health Development Group. Our mission is to prevent the transmission of HIV in Kenya and decrease AIDS through the health education so that we can prevent the creation of lost generations in the future. Similar to many developing countries in the world, Kenya is plagued by many life-threatening diseases. Some of the problems that the country faces include malaria, infant mortality, maternal mortality, respiratory infection, malnutrition, and tuberculosis. Issues with sanitation and having access to safe drinking water have played a major role in the health struggles that the country faces as well. Although these diseases are very concerning, they do not match the magnitude of HIV and AIDS, which has been very detrimental to this country. According to the Foundation for Sustainable Development, HIV and AIDS has impacted at least 7% of the population and serves as one of the main reasons that the country has struggled to develop over the course of its history. It has been reported that more than 100,000 children are currently living with this lethal virus, and about 650,000 children have been orphaned from it.
HIV stands for Human Immunodeficiency Virus. In Kenya, according to the UNAIDS estimate in 2014, there are more than 1.6 million people that live with the virus, majority being between the ages of 15 to 49. The estimated related death is about 33,000 according to the AIDS Indicator Survey. More than half of Kenyans living with HIV do not know they have the virus. Also, among the people that have HIV, only about half are currently receiving treatments. The treatment used for HIV patients is called antiretroviral treatment. It's a treatment that is used to slow down the replication of the HIV virus in order to increase the CD4 cell count in the human body.
HIV is a terrifying disease which affects large swaths of the population within Kenya. The disease currently has no cure and unfortunately is easily transmitted. Areas where HIV can spread include the male and female reproductive organs, semen, breast milk, and menstrual fluids. By engaging in safe sex, such as using condoms and not engaging in certain sexual activities, transmission of HIV can be prevented. Also, intravenous drug users who share needles are at risk of spreading HIV, as direct blood-to-blood borne contact is proven to transmit HIV. Lastly, women who are planning on becoming pregnant should get screened before becoming pregnant to reduce the risk of HIV being spread to their children.
And those that have sex with multiple partners have a higher risk in acquiring HIV. An effective way to prevent the spread of HIV is to have your partner tested before having sex. If you choose to have sex, it is recommended that you use a condom and limit your number of sexual partners. Another option is pre-exposure prophylaxis, a drug that an individual can take if they have a high risk of getting HIV. Another issue is the spread of HIV through breastfeeding. To mitigate the risks of breastfeeding, infants should be given once daily nevirapine from birth for 6 weeks and should be tested at the conclusion of breastfeeding to determine if they remain HIV negative.
Looking at the future of Kenya, we are worried about the lost generations. Lost generations are the legacies of these fundamental and crucial problems of the previous generations. According to the CIS database estimations, the next generation of Kenya will have an increasing amount of people who are raised as orphans, HIV positive and undereducated, as this generation is still unable to prevent the transmission of HIV and unaware to provide enough information to their children. As Kenyan Health Development Group, we believe that we can make a difference in the global stage in terms of solving such wicked problems only if we can make an impact in the local communities. Being inspired by the innovative and the brave idea of the Nobel Prize winner Mohammed Yunus and the Greenland Bank, which provides microloans to the locals under poverty in Bangladesh in exchange for 16 decisions, we would like to spend our budget of $1 billion to lend loans to people of poverty and women in Kenya in exchange of their pledge to join our health education program. Health education program will cover sex education, HIV transmission, breastfeeding and childcare, and how to become a healthcare official or a midwife. The primary requirement to be able to eligible for the loan, the husband and the wife has to register together and complete the program as a team. In the short run, we foresee the decrease in the HIV transmission. Furthermore, as women of Kenya will socio-economically empowered, we believe that in the long run, the significant shift in the cultural perception is expected. KHDG will be spending the first $250,000 to connect with existing NGOs and their programs, as well as building strong relationships with the religious leaders of the local tribes. Donations for the basic needs of the local churches and mosques will be made to create this network in exchange for informative briefings on how some cultural norms lead to terrible conditions in the country and for its people, and how only with their strong influence on the community we can get rid of HIV, the devil itself. The second quarter of $1 billion will be spent on creation of our health education program and for the purchase of the educational and the sample medical supplies. The rest of the $500,000 will be offered to those couples who sign up to our health education program as a team. The contract will be under the name of the woman in the family, but to receive the microloan, the man must pledge to complete the program as well.